Actually, hemorrhoids are part of our normal anatomy. They're blood vessel cushions within the anal canal, right above the exit point, and they aid us in making a seal. We have sphincter muscles around the anal canal that we use voluntarily when we want to prevent passing gas or having a bowel movement, but at rest, these hemorrhoid blood vessel cushions create a gasket or a seal. Hemorrhoids often present as a condition in which one may develop an anal discharge, like mucus, or they may have rectal bleeding, or they often can be associated with pain. However, the internal hemorrhoids are insensate, meaning that they are inside the anal canal and they do not sense pain. When a person presents and they say, "I have terrible, painful hemorrhoids," that's usually because external hemorrhoids, which occur on the outside, again part of our anatomy, but they usually are not evident until they become very swollen or thrombosed, meaning blood clot forming in it. They can be very painful. Hemorrhoids inside the anal canal are often divided into three categories. The categories relate to their positioning in the anal canal and whether or not they come out. First-degree hemorrhoids are hemorrhoids that are inside, creating that normal anal cushioning. When the hemorrhoid becomes enlarged and it tends to protrude outward, yet it responds to just going back by itself, those are second-degree hemorrhoids. Third-degree hemorrhoids are hemorrhoids that come out after having a bowel movement, but require the patient to actually push them back inside. Finally, a fourth-degree hemorrhoid are hemorrhoids that either acutely come out and cannot be pushed back in or are chronically coming out. And our treatment options for those depend on the staging or the degree of the hemorrhoids. Fortunately, hemorrhoids don't always require surgery to fix them, and most of the patients that come to see us have non-operative means of therapy. The first is dietary counseling. Our American diets are low in fiber. We encourage patients to increase their fiber by taking additional fiber supplements, fruits, vegetables, grains, drinking lots of liquids. We also encourage them not to sit prolonged periods on the toilet. The toilet has become the namesake, the porcelain library. It's where people get away and do their Blackberries, their iPhones and such, and spend way too long reading on the toilet. So we encourage them to go do their thing and get off. When we deal with the hemorrhoids, we have means of treating them in the office setting. If dietary measures, topical creams don't work, we often will rate the hemorrhoids, and our first line of therapy for early hemorrhoids that are bleeding is what's called sclerotherapy. Sclerotherapy is a technique where we painlessly look inside the anal canal and we can inject the hemorrhoids with a medication typically called phenol, which is a sclerosing or shrinking agent. That type of agent, being given on the inside where the hemorrhoids don't have nerve endings, creates a swelling of the hemorrhoids and then a scarring down or shrinking of them. The next option for larger hemorrhoids may require rubber band ligation, also a simple office treatment, where we use what's called a rubber band or ligature to go over the top of part of the hemorrhoid, which cuts off the circulation, and then within usually about 7 to 10 days, that hemorrhoid shrivels up and shrinks back to a normal hemorrhoid. Finally, we often will use what's called infrared coagulation. That's a device where we use an infrared heat source to focus right on top of the hemorrhoid in the anal canal, and we deliver thermal energy to it, which creates a shrinking and a scarring to keep the hemorrhoids back up inside.